Dear friends, good evening children all. I am Dr. Arun, consultant gastroenterologist and hepatologist, practicing myself mainly in Apollo Hospitals, Greens Road, Chennai. Today we are celebrating World Hepatitis Day. The theme for World Hepatitis Day 2022 is bringing hepatitis care close to you. What do you mean by hepatitis? In case if your liver gets infected by any hepatotrophic viruses, you are going to land up in a condition called hepatitis. Among hepatitis, there are various viruses which can commonly enlisted. For example, hepatitis A, hepatitis B, C, D and E. Among them, hepatitis A and E are mainly spread by fecal-oral route of transmission. In case if you are going to land up with this kind of complication, the infections are mainly self-limited. You may have mild fever, jaundice and all those complications followed by usually this infection will resolve on its own. In case if you are going to land up with any evidence of poor sanitation practices, unhygienic sources of water, if you are going to take food from outside, there is high possibility for you to land up with hepatitis A as well as E. But among hepatitis B and D as well as hepatitis C, they are all the viruses which can spread through a blood and blood-borne products. For example, if the patient is going to have multiple sexual partners, in case if the patient is going to be on dialysis, or in case if the patient is going to use a multiple drug abusers, there is high possibility for them to land up with hepatitis B as well as hepatitis C. And neonatal mode, from mother to child, there is high possibility for hepatitis B to spread. And these viruses are very dangerous. It can develop liver cirrhosis and you may land up with liver cancer at any point of time, and sometimes the patient may deserve liver transplant. Among world population, every 30 seconds one patient being infected with this hepatitis virus, and every year 1 million population being infected with this hepatitis virus. So in India there are free vaccination program right from pediatric age group for this hepatitis B virus are well available. Also for hepatitis C virus, there are various medications are available. If you are going to take for a period of 3 months of duration, you are going to overcome most of the complications very well. So make sure we need to make our India free of hepatitis by 2030. That's the goal should be motivated in all our minds. Thanking you all for patient listening.